Okay, another edition here as we're back, and we'll try to update you on things as they happen. There was an article from the Washington Post about the effectiveness of certain masks versus others, including a neck gaiter. And I guess we can start there specifically because we, mainly you, have brought this up over the last 16, 17 episodes that we've done, 4 months plus of content about how wearing a mask can be effective versus how it can't be, if it's a chin strap, as people say. And also, what rarely gets talked about and now has become a major point of conversation is how effective single cloth layer masks can be, if at all, especially now looking at this latest with the neck gaiters. So is this and has it been a major problem in your opinion as far as trying to just get people to wear a mask and then on top of that having them wear it correctly and the proper mask that follows?
Yeah, good question. So clearly we know what is the best protection in terms of a mask, and that's the N95, right? And anything as you go below that, anything is better than nothing, but the quality of protection goes down as the quality of the mask goes down. Essentially, what the mask does is it's supposed to cover your nose and mouth. And when you're speaking or yelling or sneezing, the mask blunts whatever spray it is by, again, having it. So if you're wearing your mask below your nose and you're infected, you're actually not protecting your colleagues. If you wear a mask that's below your mouth on your chin, again, the protection is clearly almost nil. So again, we spoke about this before, and I think that the more dense the layers are in terms of protecting from aerosolized virus, the better off you are in terms of wearing that. But people are now getting into, if you will, even to the fashion of masks. You're seeing masks out there which are fashionable. The question, of course, is have they been tested in terms of their ability to capture the virus? I don't think we have that information.
But it looks, and again, I guess it's a two-part question. So let's start with the neck gaiters themselves. How could something, and maybe you can explain it more from a medical standpoint, but I get a lot of holdups on social and just talking with people as well that don't understand the concept of what you could be wearing is actually worse than not wearing something at all. How are we at a point where wearing something like a neck gaiter could be worse than not wearing a mask at all?
Well, again, I think that, from the quick review of the article, when I looked at it, it does show that that's probably one of the lowest quality in terms of protection. So if you're going to already put yourself in a situation where you're going to be wearing some sort of protective mechanism, why not go for something that has more protection than something that may be fashionable or looks like it's easy to wear? So, we're meeting a lot of behavioral issues that people have. And there's a lot that's out there that's not been tested, but when it does get tested, we need to heed to the information that we get. And that particular publication, again, suggests that these have very low quality in terms of protection. So if you're going to spend money on it, go get some kind of a mask. And again, if you're going to be putting yourself in a situation where you're going to have to wear something that's more protective rather than something that's very poor in terms of protection.
How did we get here where this is far from the first respiratory virus that has hit? It's not even the first pandemic in that form of a SARS virus that we've seen, yet it feels like outside of the medical community where you have been beyond consistent, as have others, if it's on social media or their own platforms, about the importance of wearing a mask, even back when it was just about washing your hands. But how is all of this stuff just coming to light now, where you would think we would have pounds of data stacked up about how effective a mask can be and just how to deal with respiratory viruses, even on a pandemic level?
So you're absolutely correct, and that's an excellent point. So surprisingly, we do have data. We have data for years in terms of how masks behave, how surgical mask behaves, and how respirators behave. So this is not the first, basically, in terms of encounters that we've had to test masks. The problem, of course, is that when we had Ebola as an example, it's the different types of transmission that occurs by the virus that may put masks at the back seat, whereas when it's an aerosolized infection, such as we're seeing right now with COVID, these are very important in terms of protecting your respiratory tract. Now, we know that surgical masks, as an example, lose their effectiveness over time because they become, again, moisturized. And when they become moisturized, they may not have the same protection as when they're dry. So we do have some of the data, but again, it's never been an issue with the public. It's always been an issue with healthcare providers. And if you're entering into a room with a highly contagious, highly infectious, and highly, an agent that has a high morbidity and mortality, such as COVID, you want to wear the best, as a healthcare provider, you want to get the best PPE, personal protective equipment that you possibly can get. And we know from tests on those that those, as I mentioned, the N95 and other respirators clearly have that quality. So it's always been contained within the medical community, and the data that we have has always been around the medical community's exposure to aerosolized viruses or other infectious agents. But now we're dealing more with a public, and the public is extremely innovative because they
Could be work, so you never know, right?
so I guess you can add it.
That's
So
fine.
again, the issue with the public is the innovations that we're seeing and the types of any protective device that people can gather around their face, including homemade masks, which we're seeing all over the place. So those, again, are not tested per se. When they are tested, we see that there are leaks, and this is why the recommendation is that there be multiple folds of material to protect you. So we're dealing with something very different today, as you asked, or as the statement that you made, as compared to what we've dealt with in the past, which has been always the medical community where we do have data.
All right. How are we right now? Because numbers continue to rise, they continue to drop depending on where people are focusing. If it's infection rate, death rate drops, infection rate goes up. We've already seen in different parts of the country, from the south to the southeast, all the way up to the northeast, and now out west in California. If you're just asked a basic question, which is, how do you think right now? And again, this is the middle of August, so these questions have remained the same, but the answers have changed throughout our conversations. Are we doing any better with dealing with the resurgence, if you will, of this virus once we started to generally reopen around the country?
You know, again, you probably are exposed to multiple opinions. And unfortunately, we do have already we understand that every state is taking on a different way or a different approach to deal with this, with the infection as well as the resurgence of the infection. To categorically say that we're doing better is, I think, an overstatement. I think that we are challenged because we don't have a uniform approach to this. We're challenged because there is a significant economic pressure to open again routine life as we knew it. And now with the other burden, which is the opening of schools, it is a big concern. Now, it's very interesting. The CDC put out today a notice that the number of infected children who come to the hospital who end up in intensive care unit is the same percentage as adults. So we have seeing now an unfolding, if you will, of the pediatric population, which may put a completely different strain on healthcare as schools start opening. Because generally speaking, if you walk into any hospital in the United States, the one department that is very limited in capacity is going to be pediatrics. And pediatric intensive care units are clearly not as many around as we do have for adults. So you're dealing now with a situation that is not over by any means, and that I don't think that we are dealing with it in a unified fashion, or a uniform fashion, so that we're probably going to see these things pop up and die in different areas of the country, despite the fact that every effort is being made to contain this virus, but I don't think we're doing it in an effective fashion.
Why, as we wind down here, why did it take this long to see that increase in children and that same rate of infection of kids that are now going to the ICU? Was it simply because in the summertime, kids weren't being tested before they came back to school?
I think that the general concept right now is that children are certainly not immune to the virus, but the virus, when it attacks a young individual, the results are that they're not as sick as an adult who may be, again, attacked with the same amount of virus. So there is some sort of a protective mechanism in the young that allows for less of a disease. However, if they do become infected and severely infected, then you see the same rate of ICU admissions as you see in the adult. So overall, children are not going to be an assault, if you will, on the healthcare the way adults are. And that's probably because of the size of the population. But in addition to that, the effect of the virus in the pediatric population, I think, is a less severe infection, which can be manageable.
Any changes on what we're seeing with schools coming back? I know that a lot of athletics, right up to college football, but high school athletics were at the very least postponed, delayed, if not outright canceled. I imagine, as tough as it may be to contain something or mitigate something in a school, in a classroom, it's probably more difficult to do that in an athletic setting as well.
It, it is. There are some advantages to the athletics. Is that I think that there's a higher level of discipline amongst athletes, so that if the discipline is to control a crowd and control interactions, that may help. But again, many of the sports that we have clearly have a lot of contact in them, and a number of people on the field, whether it be basketball, hockey, or football. So again, being tested and doing everything you can to isolate people who are infected within the sport that you're dealing with is going to be very important in terms of containing it. The other advantage of many sports is that they are outdoors, or that if they're not outdoors, they clearly are in an arena where there's sufficient space, if you will. So these are the things that we're asking in terms of social isolation is distance between people, but also outdoor is better than indoor. And I think that may be something which would be that in addition to the discipline may be advantageous. But it doesn't mean that if there is an infected individual that there's shouldn't be some isolation, and there shouldn't be continued testing to make sure that if there is someone who's bringing the virus into the arena, that they again be isolated from the rest of the